All right. Well, happy Friday, everyone. Hope everyone's having a wonderful day. All right. So, I am here to answer questions you may have related to thyroid health. And so, for those, if you're in one of my Facebook groups, you're probably not viewing from the Facebook group because, again, I just realized yesterday, it's been it's been out for a while, but I didn't hear until I set this up that you can no longer live stream from not only this is a StreamYard, but really you can't live stream period into private Facebook groups. I mean, there's a workarounds. I think I was looking at a workarounds, but then I don't think you could answer comments, like you can't respond to comments and or post comments. I don't know, just yeah. So anyway, this is live streaming to my Facebook page and my YouTube channel, and I just posted in my Facebook groups this morning just to let people know that again I'll be going live, but I can't live stream into the groups anymore. Which again, kind of a bummer, but it is what it is. It's not just me; it's everybody, and yeah. So let's go ahead and let's just start out with I usually just give a few resources for those who are not familiar with me. Obviously, there's again, I should have listed the Facebook groups here because again, um, I usually don't list it here because most people tuning in are usually in the Facebook groups. But anyway, besides the Facebook groups, the Facebook page, there's my podcast, and you could check out either by visiting the website savemythyroid.com and clicking on podcast, or just visiting your favorite podcast platform, and typing inside Save My Thyroid. And so, as far as the podcast episodes, there's a little bit more focus on hyperthyroidism, but most of the episodes will benefit those with either hyperthyroidism or Hashimoto's. And the reason there's a little bit more focus on hyperthyroidism is just because there's really, this is, as far as I know, the only podcast that has a little bit more focus on hyperthyroidism. Just about all of the other ones have more of a focus on hypothyroidism. And my experience personally is with hyperthyroidism. And yeah, so anyway, that's the reason for that. And also, so SaveMyThyroid.com, that was released in 2021. And again, that's the mainly because it's a catchy name, at least I think it is, and that's the name of the podcast. And but my original website, naturalendocrinesolutions.com, was released or launched in 2010, so about 14 years ago. And on the website, you can find hundreds of articles and blog posts. I also have a supplement line, which you could check out by visiting thyroidsave.com. And then I have a few books. So my very first book, which was recently updated in fall of 2023, Natural Treatment Solutions for Hyperthyroidism and Graves' Disease. So the original edition was released in 2011, second edition 2 years later, and was way overdue for an update, which again happened last year. And then in 2018, hard to believe, 6 years ago. So yeah, eventually we'll see as far as updating Hashimoto's triggers. Yeah, just a lot, not as difficult to update a book, but still not easy too. And arguably a lot of the information in Hashimoto's triggers is still relevant. But again, so that's another book. And then I just released in March of this year, so last month, the Hyperthyroid Healing Diet. And so it's a comprehensive book on diet in those with hyperthyroidism. So the original book, Natural Treatment Solutions for Hyperthyroidism and Graves' Disease, it does have a chapter dedicated to diet, but I still, over the years, have gotten a lot of diet related questions and decided I'm just going to have a book that's dedicated to diet and hyperthyroidism. There are a number of them related to Hashimoto's, but again, I think there are like one or two like smaller books, like if you look on Amazon, but they're maybe like 50 pages long or 100 pages long. Just yeah, the people didn't really put a whole lot of effort into it. At least it doesn't look like they did. This book is 400 plus pages. And I didn't have room for recipes, so I have a resource center, or resources that go along with the book where there's recipes and other resources. And you can find those on Amazon, and the hyperthyroid healing diet's still not on Barnes and Noble. So I'm trying. It should have been by now, and I had to reach out to the company that distributes it, and they really didn't give me a good reason, but they just said they're gonna kind of redistribute it. And anyway, so hopefully it'll be on Barnes and Noble soon, as well as other websites. But you could definitely find them on Amazon. All right. So if there are questions, let me know. I know I've answered lately a good amount of questions just because I had a 5-day challenge in. Well, I had one in January, but then had one right after the book was launched, so the week of the 18th. So about a month ago, I had a 5-day challenge, and then I just released a podcast episode of Your Thyroid Questions Answered. And I wish I could have gotten to everybody, but it was already like an hour or so, and the Thursday episodes are not supposed to go that long. Just again, I have like an agreement with the editor about doing pretty much Tuesday's episodes. They know will be maybe up to an hour, and then Thursday's episode is only supposed to be like 10-15 minutes. Every now and then, she knows I do a questions that Your Thyroid Questions episode, but initially I think it was only supposed to be like 30-40 minutes. So just try not to take take advantage of her too much. But yeah, like I said, there's looks like there are questions. So let's go ahead and see here. So we got Gracie Lou watching from Hong Kong and sending love. Well, thank you, Gracie. Thanks for watching. And all right, yeah, it looks like you're tuning in from YouTube, which is cool. Normally with StreamYard, with the plan I'm on, I could only stream to 3 platforms, and I would always stream to the Facebook page and my 2 Facebook groups. But now, since I can't stream to Facebook groups, I'm able to stream to my page as well as to YouTube. So again, pretty cool that we got some people on YouTube with questions. So Gracie asked, just want to ask if my eyes will go back to normal once I'm healed from hyperthyroidism. My one eye is bulging. It really does depend. I mean, I do work with a lot of people with thyroid eye disease, and I do see some amazing changes once they restore their health, but it does depend on the severity of the thyroid eye disease. Some people, it does go back to normal. Others, it's greatly improved, but not 100% where it was. And then there are some cases where it's like really severe and it doesn't go back to normal, maybe a very minimal changes. So it does depend on the severity. I mean, there are other modalities, like one of the newer ones that came out in the United States in 2020 was Tepezza, and I have some information on my website and podcast, and involves 8 infusions, but side effects are common, and so it definitely wouldn't be my first choice. But that, I know that has been effective with eye bulging when a natural treatment approach may not be. Obviously the surgery too, which it should be a last resort. But yeah, so again, let's hope that as you do things to improve your health. I mean, just remember, thyroid eye disease, like Graves, it's an immune system condition. So you want to do things to optimize your immune system health. And then let's hope the eyes will also greatly improve and hopefully normalize. All right, Lisa Ann, hope you're doing well. Lisa Ann says, hi, Dr. Eric. After months of normal, my TSH has dropped to 0.22. Would you suggest L-carnitine or acetyl L-carnitine? Any suggestions to the milligram? I've added Brazil nuts and I'm back on a gluten-free diet. I think a tragic event triggered the hyperthyroidism. Oh, I'm so sorry, Lisa Ann. Yeah, sorry. I mean, sorry about the TSH dropping, but definitely don't want to hear anybody have to go through any tragic events. So I'm sorry about that. I mean, that's great about the Brazil nuts, and I think that's good also about the gluten-free diet. So typically, I mean, the research shows L-carnitine tartrate blocking thyroid hormone into the cell, and the research shows between 2,000 and 4,000 milligrams. So if I had to choose between the two, I would choose um, I would choose L-carnitine over acetyl L-carnitine. I do have a product that has both. It's SMT carnitine supreme. and it has 400 milligrams, I believe 400 milligrams of L-carnitine tartrate and 100 milligrams of acetyl L-carnitine, because there are some benefits to, to the acetyl L-carnitine. But if you're just taking it purely from a thyroid hormone standpoint and to help with the TSH, you would take the tartrate. And like I said, the milligrams, I mean, it depends on the person, but like for example, I might start someone off with 1,000 milligrams twice per day, and typically away from meals or before meals, like 20, 30 minutes before meals, let's say. All right, so let's see. We have Terry here. So, what is a safe amount of iodine for Graves? I know we all need it. I'm just afraid of too much. Yeah, I talk about that in my, I mean, I talk about it in my, really all my books. I talk about iodine, but in the hyperthyroid healing diet, I talk about 500, like how most people seem to be able to tolerate 500 micrograms or less. And some people could tolerate more than that. Everybody's different. Now, is 500 micrograms a safe amount? I mean, I wouldn't say 100%. I mean, I would say, again, there are some people that claim that even if they have a multivitamin with iodine, they notice a difference. But I would say for most people, 200 micrograms or less is safe. But like I said, I think most people, 400 or 500 micrograms. Like if they're taking a multi, let's say that has 150 micrograms of iodine, and then they're having not high amounts of food sources of iodine, like if they're eating sea vegetables, that's really a lot of iodine. But like wild salmon has, I think, like 30, 40 micrograms of iodine. And I have what my book, The Hyperthyroid Healing Diet, and the resources there. There's a bonus chapter that talks about iodine and food, expands on it and gives like microgram doses for seafood and sea vegetables. But if someone's having, let's say, 150 micrograms, just as an example, of iodine in a multivitamin, and they're having a couple of hundred micrograms of iodine from food sources, which again, most people might not. I mean, I would say that most people probably won't get that much from food sources every single day. But if they do, that's still, let's say, 200 micrograms from food sources, 150 micrograms from multivitamin, that's 350. Most people would be okay. It's when they, if someone takes a high potency iodine supplements, in the milligrams, or again, they eat sea vegetables or a lot of shellfish, like regularly daily, then that might pose problems. But yeah, so that, hopefully that answers my question. And if you haven't checked out the hyperthyroid healing diet, you might want to look more, maybe invest in that, and then also you get the resources where you get that bonus chapter too. But I pretty much kind of revealed what I consider to be a safe amount, but there are exceptions. All right, so Elizabeth, so hi, Dr. Osansky. I've started to have internal vibrations in the middle of my chest. I've read that some people have experienced this when they are in a hypo phase. Um, all right, so internal vibrations and about hmm, yeah, I mean, some people, I don't know if people would, and again, I can't say that like out of the people, when I see people with either Hashimoto's or again, someone who has hyperthyroidism, who's taking anti-thyroid medication, let's say, and they become hypo, or if they just like have the antibodies for both Graves and Hashimoto's and they start out as hyper and eventually become hypo. Yeah, I would say the majority don't describe it as internal vibrations. I'm not saying that's not what what you're experiencing. Um, and like you said, you've read that some people have experienced this, so I can't say it's like a common finding. Some people with hypothyroidism talk about palpitations, and sometimes I wonder if that's in some cases, not to say it's not palpitations, but I think it's different with Graves. Like when I dealt with hyperthyroidism, when I dealt with Graves, the palpitations were like kind of like a thumping and just again, not like really bad thumping, but at night was more prominent because everything was quiet. So it seems a little bit different with hypothyroidism, like kind of more like a fluttering and maybe like a vibration. And so some people might think it's more palpitations with internal vibrations. I mean, either way, you want to balance the thyroid hormones. If thyroid hormone's too high, you want to lower that. If thyroid hormone's too low, you want to increase it. Um, so either way, you want to balance the thyroid hormones. Obviously, in the case where it's autoimmune, you need to do things to improve the health of the immune system. All right, and then Gracie again, your channel and video just popped up in my feed today, and I watched and learned a lot. Oh, wonderful. Okay, that is wonderful. Thank you for letting me know that. And yeah, maybe doing these live because again, I don't do a lot of YouTube lives, but now when I do these Q&A lives, I'll be doing it. I'll be broadcasting it both to my Facebook page and to YouTube, since again, Facebook no longer allows live streaming to their Facebook groups. So yeah, maybe others will also get it, get the live ones. So I guess we'll find out. But let's see. Gracie, I will try to bugleweed supplement, doc. Oh, okay. Yeah, yeah, you might have heard my story. So when I dealt with Graves, I work with a lot of people who take antithyroid medication, so I'm not against it, but I chose to take bugleweed as well as motherwort. Bugleweed is an herb with antithyroid properties. Motherwort is kind of like a natural beta blocker, and it works really well for me. Again, doesn't work for everyone, but yeah. So thank you for letting me know about that, and yeah, hopefully that works for you as well. All right. What other questions? Oh, we got Gracie Lou again. So my latest thyroid function test. So we got um oh yeah, where are you located overseas, Gracie Lou? Just because these are different units, it looks like, than United States as far as free T3 and free T4. These would be like crazy high in the United States. So I think the units are a little bit different because I know in certain, like for example in Europe, that they use different reference ranges, like yeah, the free T4, I think, like up to 20 is in the normal range for, depending on the lab, whereas in the United States it would be like, if it's over like 1.8, or 2, it's considered elevated. So either way, free T3 really high, free T4 also pretty high, and not a surprise, TSH is depressed. TSH is a pituitary hormone, so if both thyroid hormone levels, or even if one of them is elevated, typically TSH is depressed. Okay, so Gracie Lou is joining us from the Philippines. Okay, all right, wonderful. Okay, I want to or the test is in this Philippines. That's right. You did say that you're in Hong Kong, right off the bat. You mentioned you're in Hong Kong. So I want to continue my treatment here in Hong Kong. Okay, wonderful. All right. Well, thank you. All right. What other questions do we have? I'm going to take a quick sip of water. All right, Lisa Ann, is it common for a tragic events to cause a reoccurrence of hyperthyroidism? I mean, stress definitely can cause a relapse in some people. Like when people relapse, it's usually because of I mean, it could be chronic stress over a period of time, but it could be a traumatic event, or tragic event. So yes, um, sometimes it's they fell off the wagon and just been not eating well for a while, and then sometimes it could be like an infection. Like when the pandemic hit, we had a number of people develop hyperthyroidism, and then people also who relapsed, who had a history of Graves. But yeah, a traumatic event, yeah, it's not uncommon for it to cause relapse. So again, sorry about that. But I know you're dedicated. I know you'll do what you need to do to get your health back. All right. If there are other questions, definitely let me know. Yeah, when I live stream to the Facebook group, there's a lot of people in the Facebook group, about in one of them, there's close to 15,000, and then my other one, there's, over 7,000, so combined, like 22,000 plus. The only problem is that with Facebook, the algorithms, that it just doesn't reach most of the people, so if it reached most people, we probably would have like a few hundred people viewing these, but again, it only reaches a small percentage of people when doing a Facebook Live. Okay, Elizabeth, should I stop treatment once my TSI is undetectable? I mean, I'm not sure if you talk about like with antithyroid meds or, I mean, if you are, I can't really give that advice because again, I'm not your practitioner. I will say that once the TSI is undetectable, I mean, you still want the thyroid hormone to look good. So like I when I dealt with Graves, I pretty much stopped what I was doing when my thyroid hormones look good and the TSI look good. And it varies. Like some people, the TSI, the thyroid panel will look good before and usually the thyroid panel looks good before the TSI is normal. Some people it's the opposite. So I ideally want both. And then if someone's TSI is negative and the thyroid panel is looking good, then typically the prescribing doctor usually will tell the person to stop, but not always. Because again, if it's, let's say, if they've been on methimazole for 6 months, the doctor might say you need to be on it for a year and a half, and maybe it's a small dose, maybe it's like 2.5 milligrams. And again, I can't tell someone like, okay, in my opinion, you should stop. I can't even say that. In my opinion, you should stop taking it. Or if that were me, I guess, I mean, I could say that. If I was, and I mean, if it were me, I probably would, if everything was good. I mean, I would want to make sure things are stable. I will say that. So, like, even when I was taking bugleweed and everything was normal, I didn't just like stop taking it. I gradually decreased the dosage and eventually weaned off of it. And that's typically what you want to do with the antithyroid medication. Um, but again, some endocrinologists will want to have you stay on it for a while, even when the numbers are normal. And that's really up to you. I mean, if the TSI is elevated, then I could definitely understand because you're at a greater risk of relapsing. But if the TSI is negative, and if it seems like someone is in remission, then there's a lesser chance of them relapsing. So Gracie Lou says, I am sweating a lot and palpitations. My endocrinologist prescribed methimazole and propranolol. So, yeah, pretty common recommendations. Methimazole, the most commonly prescribed antithyroid medication, and propranolol is probably in hyperthyroidism the most commonly prescribed beta blocker, just because it also helps to inhibit the conversion of T4 to T3. Well, I'm glad we got like right into the question. Sometimes when I do these Q&As, it'll take like 5 minutes for someone to ask the first question. Then usually when we get the first question, like it starts rolling, but we didn't have, yeah, we had people asking right away. All right, Lisa Ann, thank you. Your podcasts and books are so appreciated. I have L-carnitine, but we'll get L-carnitine tartrate right away. I'll also check into your SMT Supreme supplement. Anything else to help raise my TSH? I mean, that's the main. I mean, I think, is yours subclinical? Like, because again, and when I mean subclinical, like, is your thyroid hormone levels normal, but your TSH is low, or your thyroid hormone levels elevated? Um, Reason I ask, I mean, if thyroid hormones are looking good and TSH are low, then I probably would just stick with the L-carnitine. But if the thyroid hormone levels are elevated, then you could look into something like bugleweed as well. Yes, all normal, just the TSH. Yeah, so it's more like subclinical. So I think the L-carnitine, because you don't want to take too many like things that are anti-thyroid, and yeah, so I would say in that situation, just maybe taking L-carnitine, because L-carnitine, the bugleweed, pretty much the main benefit of bugleweed is its antithyroid properties, whereas L-carnitine has other benefits as well. So, Yeah, so I think just sticking with the L-carnitine is a good idea. All right, if there are any other questions, let me know. If not, that's okay too. All right, we got Gracie Lou. Is it safe to take glutathione capsules with hyperthyroidism? I mean, I there's nothing in the research showing any contraindication that I'm aware of, and I've for years recommended either NAC, N-acetylcysteine, which is a precursor to glutathione, and in some cases I do recommend glutathione, like liposomal glutathione, for example, or acetylated glutathione. So I've not seen any problem with having people with hyperthyroidism take glutathione. If anything, I've seen some good benefits because glutathione is the master antioxidant, so it can help to reduce oxidative stress, which is pretty common with hyperthyroidism, very characteristic of Graves' disease as well as thyroid eye disease. And for those with Hashimoto's, also, it's something I commonly give people with Hashimoto's, NAC, again, sometimes glutathione. So hyper or hypothyroidism, I have not seen any problems with patients, or not really haven't seen anything in the literature as far as any contraindications. And so Gracie Lou is using liposomal glutathione and selenium with zinc. All right, wonderful. All right. Well, thanks for letting me know. All right. Anything else? Any other questions? All right. Yeah, if there's any other questions, I guess we'll do last call for questions, and as far as my next appearance, March we did a lot of questions with the challenge. I wasn't available in March, or actually I might have done one early. Actually, early March I probably was live, and trying to see if there's any Facebook lives. Sometimes on Fridays, someone again, not everybody wants to go live, but a lot during this time, I'll do a Facebook live if someone wants to do a Facebook live, like an interview. Again, that might change though. I forgot there's no more. It would be I guess live or live stream, but to the YouTube channel, and then yeah. Anyway, so yeah, might be different in the future, but yeah, let's see. So when's Friday, May 10th? Maybe I'll do another Q&A possibly then. So we will see. But let me just double check, make sure there's no other questions here. Oh, let's see. We do have Terry. Is it possible to shrink thyroid nodules? Yeah, I mean, in some cases, again, I don't want to say 100% of the time they could be, you could shrink thyroid nodules, but when someone sees me with thyroid nodules, that's one of the goals is to try to see if we could shrink them, try to address the cause of the problem. I do have some podcast episodes on nodules. I have on my website, naturalendocrinesolutions.com. So some of the common causes of thyroid nodules, problems with insulin, problems with estrogen metabolism, insulin resistance, just overall inflammation could be factors. Sometimes iodine deficiency, again, the controversial iodine. So yeah, when they're really big, it's not that it's not possible, but then in some cases, people might want to look into not again not radioactive iodine because I don't recommend that. But then there's what's called radio frequency ablation, which just pinpoints the thyroid nodule. And I have information on my podcast on that too. I have a solo episode where I talk about that, and then I've interviewed Dr. Angela Mazza, who is an integrative endocrinologist who practices in the Orlando, Florida area, like Central Florida. So yeah, so it is possible, but even when we can't do it, uh, and if it's really large, and if, let's say the doctor is recommending surgery, radio frequency ablation is an option for some people as well. Yeah, I should do for like for my podcast again. Every couple of months, I have a thyroid questions answered, and should one day try to do it live like this, and then I can answer questions live, just like maybe screen share the questions that was sent in and answer it this way. But only thing is that there'll be more questions from the live people, and again, it's not a big here. I'm specifically coming for live questions, but if I go and answer live questions for an hour, and then um, not a bad thing. I mean, I could always do live questions after for like 15-20 minutes too. But yeah, maybe something I'll consider in the future, just doing a live your thyroid questions answered, where people could yeah, because with that, I ask for people to email it in, but kind of a combination. Like when I do my challenges live, I'll have sometimes like Q&A sessions where people could attend live or email questions. So, but all right. Well, I think I am going to call it a day because looks like we're out of questions. But again, thank you so much for tuning in. And again, I'll try to. I mean, next time, as of what 5 days away from May. So the next one will be in May. I'll try to do at least one, if not a couple in May. We'll see. Definitely look to do one Q&A session in May. Hopefully a couple, depending on the schedule. I'm doing a lot of interviews. I have the podcast, and then I have a Thyroid Summit coming up later in the year. So I think I have like so far like 13 interviews, 13, 14 interviews scheduled in May. So combined with patients, it's going to be a hectic month, but I'll try to get in at least one of these. Next weekend I'll actually be attending a health conference. But yeah, so like I said, maybe possibly May 10th, but May 10th or the week after May 10th or May 17th. So all right, but again, thank you everyone. Thanks Elizabeth. Thanks Gracie Lou, and we got Terry and Lisa Ann. And again, appreciate everyone asking questions. Hope everybody has a great rest of your Friday, a great weekend ahead, and look forward to seeing everyone soon. All right, take care. Again, thank you.